We have a packed agenda today, so we're gonna move pretty fast. I also sent the PowerPoint. We'll have to resend it because Chris made some updates this morning, but we will send that to you. And you also have the PowerPoint from our guest speaker today and a link to the civil rights video. I hear there's a technical issue with that link, so we will address that. But we have part 2 of the meeting at 10:30 where we're presenting the video again. So we will definitely resolve those issues. And for the agenda today, as I mentioned, we have a guest speaker, Helen, who's the executive director with West Valley Health Equity. She's going to make a presentation. And we also will be talking about the wildfire updates, as usual, the policy updates from DES, and open the table, so to speak, for success stories, announcements, and additional questions, etc. And our next meeting is the 14th. So we'll move on with the agenda. I believe next on the agenda is Helen, and I think Helen's on the line. Helen, you can unmute yourself and you're on.
All right. Well, thank you guys all for putting this together. And my name is Helen, obviously, and I am the founder of West Valley Health Equity and also owner of West Valley OBGYN, which we've been OBGYN practice in the Maryville area for the last over 10 years. And so we, with our, and yeah, I think you've got that slide deck on there for me. So we have been serving the women in this underserved population for, like I said, 10 years. And as the growing needs have come up in the area, we've kind of sat to the table and we're like, what can we do? How can we make a bigger impact? How can we meet the needs of our patients where they're at in the community? And so we are very much a community based practice and entity, and we drive a lot of things about bringing things back into the community and really understanding what impacts and what barriers our patients are finding in order to find their optimal health equity. And so one of the things is what we really look at is what impacts your health, and what looking at from the physical environment, your healthcare, your health behaviors, and the social economic factors. And so if you can go to the next slide for me. One of the biggest barriers that we've kind of found in with trying to help treat the needs of our patients was there was a big gap in housing model, as there was a lot of things when we've noticed the increase population of patients that suffer from substance abuse being unhoused, trauma, SMI, all of these things were coming up at an exponentially higher rate than they had in the past. And so we were like, how can we fix this? And we just kept where it was basically snowballing, where it would just we'd be able to address one thing, but it would just kind of go back in and revert back because of their housing, if their environment isn't there. And so in 2022 we looked and said, how can we incorporate housing into our model, especially with our pregnant and parenting mothers? It is one of those things that if they can't overcome that barrier, we found that we really couldn't overcome any of their healthcare barriers for mom and kiddos. So this is when we decided, all right, this is what we're going to do, and let's see how we can help with that. And we've done in conjunction with our family, there's a Desert Bloom Family Medicine, which is a family medicine practice down the hall with us. And we've just really looked at continuing, and we continue to do this, look for what the gaps and the holes are in care. And so that's where, and it was great coming and partnering even with SNAP, because that another part of their gap is access to resources. And so this fills in another one of those gaps. Can you go to the next slide, please? So this is when we started our housing, we opened up our first home in March of 2023, the Magnolia House. And we opened Lily House shortly after that. And since we've done this high tech, we've actually got another property. So we will be opening up actually 2 more houses in the first quarter of 2024. And then we have another property, our Rose property, that is actually just starting construction and will be completed probably third quarter of 2024. So we're super excited about adding more beds and the more families that we can help with housing these pregnant moms and their kiddos. So next slide. So a lot of the things that we're really looking to do is, like I said, is integrate as much of the care that we can and wraparound services. We find in our population that there's a lot of barriers that they face. And one of the great things is that we really rely on our community partners with doing that and putting them on in contact with those community partners around, because there are so many resources out there and some great entities that are offering those resources. The patients just have a lot of barriers of having to find those and get them and navigate those. So we've worked with the SHIFT team and are partnering with the Maricopa County Public Defense Legal Clinic in our office. So it's nice because we've got them, we're being the brick and mortar for them to be able to see those patients so we can get legal representation for them. We have an access enroller part of our team so they can also get their benefits from.
This meeting is being recorded.
In the we have substance use services for where we can treat patients with OUD and MOUD. And we can customize kind of that treatment with that. We offer peer support services as well as behavioral health services and additional supportive services with like life and work force, parenting education, social connection events, and wellness education. So we're trying to wrap around all of these services. Some of them we do in-house and some of them and a lot of them, actually most of them, with our community partners out there. And so, like I said, we wouldn't be able to do a lot of the things that we do without our community partners. Next slide. We are really taking an integrated care approach with meeting these moms is care in the community. One of the things that I've really found being in this community the last 10 years is that the more that we can integrate the care into an environment that these patients feel comfortable with, the more they will be able to complete and be compliant with that care. It's really hard when you go to a PCP and you get a referral out to 5 other specialists, the patients have a really difficult time navigating that and going where it's already a very large barrier for them to get to the doctor in the first place when they're trying to manage their children from even transportation to trying to get off work and things like that. So the more that we're trying to integrate and that we can bring any of those services to the patient here in-house, we're trying to. One of the good things that COVID brought was the enlightenment of telehealth and being able to bring specialists to the patients via telehealth and working and integrating that care for specialists through that. So when we have these patients in-house where we could have in the past sent out a referral to a specialist 5 different times, we can't get them, or we can send them out for services like housing, access, getting their access enrollment, getting their WIC benefits or their SNAP benefits. We're trying to create all of that so they can get that here, because a lot of times, even though we can refer them and say, here's a pamphlet, here's these services, they walk out the door and they kind of shut down and don't know how to make it happen. So we're trying to have as many health advocates and peers and care coordinators here on site to help them walk through getting those services through our partnering our community partners. Next slide. Again, this is where our targeted interventions that we're kind of aiming to achieve is that client engagement. We're really trying to get our patients to get to all of the services that are out there in a means that they can. And so we're really trying to bring that to their community, to their safe space, that not asking them to step out of their community to get it. We say we realize that there are barriers to having to leave their community or leave their comfort space. And so as many of those that we can bring to them here in, that's what we're really trying to do that. And we're trying to, and in turn, that will reduce healthcare utilization reduction. It's really hard. We've come into an environment now that a lot of patients are using emergency services as their primary care. And unfortunately, the cost to our healthcare system is going up and our outcomes are not improving. They're actually getting worse. And so we're really trying to take an integrative approach of bringing those down, those healthcare utilization costs down and our outcomes better. And again, not ignoring the total health in clients, where it is not only their medical health from, it's a total care. Health is impacted across the board, from their housing to their diet, to their mental health, to their behavioral health, to their medical. So we can't treat one without addressing that person's entire health outlook. And again, part of that is that legal advocacy, where sometimes those barriers that our patients in this face, in which then it shuts down their healthcare all in total. Well, they won't seek healthcare in the fear of legal ramifications. So we're trying to knock down as many of those barriers as we can, one at a time. Next slide. And these are some of this is just some of our, it's kind of our hooray board of our first year impact. So the nice thing is 89% of our participants were enrolled in care, which means we were able to get them enrolled in some additional services that they had not already got. We've been able to avoid any maternal overdoses. And like I said, 74% of our participants have maintained their recovery, which is a really great statistic compared to national average. And our preterm birth rate, we've been able to keep these babies in longer and keep them healthier. So that's really great, and keep them out of the NICU. So it's amazing. So, and we've also been able to maintain the women that we've housed into creating and setting up their PCP and their services without having to run to emergency services. And so, like I said, lowering their costs. So we're really excited about what we've been able to do the first year. So we can't wait to see what we can do in the years to come, as we've been able to become and partner with a lot more community partners out there. Next slide. So one of our really big things that we're also excited about in 2024 is we are going to be broadening, and we are going to be taking some of these and offering a lot of our services to our teens. And we've realized that the substance abuse and the teen behavioral health issue is really problematic, especially since post-COVID. So we are going to be taking that on in 2024. We're super excited about that. We've got some really great community partners that we are aligning ourselves with right now, and we're super, super pumped about that. So next slide. So that's basically is all our contact information. And so one of the other things I want to put out there that is a, cheap push is we do harm reduction Fridays here at our clinic on 43rd Avenue in Thomas. if there's any of the you guys community partners that want to come up, set up a table, set up a booth, we do it right now from 10 to 2 every Friday. As many community partners and resources that we can get here out on Fridays, we would love to see anyone. So here's all of our contact information. Please message me. And like I said, as many resources that we can get to our community is what we're really about, and bringing it to them within their community. Thank you guys so much. I appreciate all the support.
Thank you. Thank you, Helen. I invited Helen to present today because I visited her and Teresa Scott and her team, and I was blown away by everything they're doing. And Helen is very humble. She talks about all the houses, Magnolia Lily, and it's, as you can imagine, it's a lot of work and logistics involved. So, I think she's a great resource in terms of, how do you do all these things? It's not easy to do. And she mentioned collaboration. So also, if you're thinking about doing some of the things that Helen and her team are doing in Phoenix, feel free to reach out to her. It's an amazing place.
I've got an amazing group, amazing team that I work with that's been doing the work for a long time. So
like I said, you're like the Energizer Bunny. So I truly respect you and the work that your team does. So thank you for joining us. Are there any questions for Helen? You can feel free to reach out to her on your own privately as well. But if you have any questions, let us know or put it in the chat. All right, we're going to move on back to the agenda. And Helen, thank you again.
Thank you,
Myra. You're awesome. All right, so we also have some new partners we want to welcome to the team, to the family team. Paz de Cristo in Mesa has joined us as a SNAP partner, and Bia's Families has also joined us. So at our next meeting, we will ask them to talk a little bit about the services that they provide and spotlight our newest partners. All right, next slide. All right, Cognito. All of you should be familiar by now with Cognito. So you guys have been doing wonderful in terms of submitting your invoices. We still have a couple of late invoices, but it's been a pretty good transition to the new system. So again, here's the link for the monthly invoice and activity report. And Chris recorded online PI AR demonstration a while back, so we wanted to share that again. If you have any specific questions, let us know. Chris, anything new that you want to share with the team?
No, I don't think so, unless there are questions or problems. I think we've been doing okay.
Okay. If you happen to submit your monthly report in error or submit the wrong month or something, just send us a quick email and we'll reopen the portal for you. All right. All right. So again, Incognito, we have an updatable emails contact list. So please enter your information here Incognito. There were a handful of people who had not entered their information. So I went into the old master list from last year and added some names, but going forward, we really want to stick to the names that are generated from the Cognito system. Chris, someone did email me earlier that they had an issue with entering information in this module. I think they were entering the person's name, but since they did not enter the person's email, they could not enter the info for the civil rights training. So that may be something that we'll look into. And if there is a glitch there, a little bug, we will, when I say we, it's Chris, he's the master tech. we will address it and get it resolved.
Yeah, there were some questions about it, but I've been trying to test it and it looks like it's working okay. So if there are individual problems that you're having, just communicate by email, but I guess we'll do that on an individual basis. Unless there are widespread problems that people are having, let me know.
All right, awesome. All right, and then the consumer survey, we talked about this at the last meeting. The surveys are required as part of the contract with DES. We've updated, excuse me, the links. So you have a link. We have a link to the online form in English, online form in Spanish, the QR codes as well, Chris created. We also have, you also have the ability to print out paper versions. And you can do both. It depends what works best for the community you serve. And all the links are here. And then I think in the next slide, we have the QR codes. And most of you are familiar with this. For the new partners, if you have any questions, we can have a small meeting and go over the consumer surveys. And we added some FAQs from last year. People had some questions about, are they anonymous? If the clients do not wish to complete the form, it is voluntary. I recall seeing in one area, Chris, you and I talked about this last night. It says there was guidance that if the person does not self-identify as their ethnicity, Latino, white, Black, etc., that the staff is supposed to do a best guess estimate. So we'll seek
Yeah,
for. You recall, Chris, we talked about this yesterday?
that's coming up, I think, in the civil rights training video at the end. I think there's an outdated policy in that training video based on some guidance that we got from Marina a month or so ago about identifying people's ethnicity by site. I think that was a requirement before from the federal government, and now it's been changed so that that's not required anymore, and the people do not need to be identified in their ethnicity. So I thought we should just kind of bring that up for when we do the civil rights training. And if anybody from DES is on the line that knows more about that, they can chime in. But I think that's later for the civil
Okay.
rights training.
Thank you for that clarification. Yeah, it's an important clarification. All right, so again, there's some FAQs from the past in terms of the logistics of the survey. We're asking for the survey results to be sent to us by February 9th so that we can compile everything and share it with DES. We'll send out reminders. Okay, so this is something new that we're going to try. Sometimes, as you know, I've been on the road a lot and will be on the road a lot more. I have visited about a dozen to 15 sites across Arizona, but I have about 50 more. So what I wanted to do is just set up a standard time virtual office hours starting February 5th. That I will block out from 12 to 5 in my calendar. And if you have a technical issue or just want to talk about something, whatever the issue may be, or the item you want to share, you can send me an email and try to remember to type VOH request, and then we can block out half an hour or an hour. But this is a time that I will book as best as possible in my calendar to be available just for the SNAP partners. All right, so we will move along to SNAP Day in May. Some of you may recall that we talked about having a day when we bring all the partners together in person. It's a celebration of all the work we do, the recognition of the work you all do, and it's also training. So I'm asking for volunteers to join the planning committee members. Laverne, I'm gonna reach out to you specifically, and Munira from Charity Staffing. But I'm looking for volunteers to help plan the day. We want it to be engaging, interactive, fun-filled, and also have a guest speaker and do some training as well. So some of the tasks that we need to do is vet the training locations. We anticipate there may be more than 100 participants. And we have partners as far as Pine-Lo. So we do have to figure out logistics in terms of location, workshop trainers, guest speakers, registration, develop the workshop topics. You all get to define that. You know, what are the areas that you want us to identify such subject matter experts? Tech Media Master, monitor workshops. If we want to do raffles, we have to, you know, figure all these things out. So it's like a mini conference, a one-day mini conference. So if anyone is interested in the planning committee, again, this is your day. So if you want to be involved in shaping it to any extent that you're available, please let me know. All right. SNAP material order forms. This is a standard slide that we have each month. There are about 3 or 4 orders that have not been mailed yet. So I will be following up in the next week, getting them over to you. But if you need any materials, this is the link to order materials. We are looking into, we had a request yesterday from Charity Staffing for Dari, Gari, and I think Pashto. So we will be looking into creating materials in those languages as well. SNAP collaboration video. Marina's shared with us a SNAP collaboration video for clients. It's available in Spanish and captions and ASL as well. So I wanted to share that with you, and the link is here. I think the next slide is just a picture once you sign on the link. So it's a great video, and it's not that long, so you can, you know, play this as people are waiting for their appointments in the lobby, post it on your website, share it with staff, play it at your staff meeting. It's a great resource. All right. And then the National Anti-Hunger Policy Conference, better known as the FRAC, F-R-A-C conference. That is coming up in June. From what I hear in the past, it's always been in May, so there's been a change to June. Some of you have already allocated funding in your budgets to attend this conference. For some of you, this may be new. So I encourage you to go to this website and check it out. It's in Washington, D.C. I believe it's a 3-day conference. And the next slide, Chris. I did see that there are scholarships available. So if you're interested, click on the link and learn more about how these scholarships work. Wildfire has allocated some funding to provide some stipends, as we have in the past. So probably within the next month or so, we will be putting out the information, sharing the information rather, in terms of how to apply for the stipends. I believe it was first come, first serve in terms of the requests in the past. But check out their website if there are opportunities for other types of scholarships. Check it out. And for next year, The new application for FY25, believe it or not, is due March 31st. Next month, we'll be talking about that. But for next year, include the FRAC conference, transportation, lodging, etc., in your budget. We would like to have a very strong presence at this conference. Marina, Gloria, did you want to make any comments about this? I think when we talked, you said, I think Adelante and Helping Families in Need attended last year and you guys were able to connect.
Hi, Myra. Yeah, so last year we were able to connect with a few of the community partners, and it was a great presence for Arizona. We actually, I think, if I understood correctly, we had the highest attending conference from Arizona last year, so that was great. And we'd love to be able to see more of the community partners attending in the future. I know that Myra talked about allocating funds for this conference for next fiscal year. I will say if you would like to attend this year, we can talk about amending your current budget to include these funds, since we are in the middle of making some budget amendments. So please, if you would like to attend, reach out to Myra right away. We are in the middle of starting to work on those amendments. I think, correct me if I'm wrong, Myra, but we have a deadline of the 19th to have all of this information from Wildfire. So you would need to get with Myra within the next probably 3 to 4 business days to ensure that you are able to amend your budget. So we look forward to seeing as many of our community partners in DC this year. Like Myra said, June 3rd through the 5th. It's a great time. If you attended last year, they changed the venue, so we're going to be at a new location this year. We'll be centrally located. I believe it's within blocks of the White House, within blocks of Capitol Hill. So we'll be pretty close to all of the excitement, right? So looking forward to it. If you have any questions, please reach out to Myra and Chris, and they will go ahead and notify myself and Gloria. Thank you so much, Myra.
Thank you, Marina. And definitely, once we know who will be attending the conference representing SNAP Arizona, we will coordinate it so that so that we can all get together when we're up there and meet in person. And at a minimum, maybe have some coffee. But we will definitely connect once we're up there in Washington. All right, so DES updates. Adele, I believe you're going to be reviewing this from DES.
Actually, I'm sorry, Maria. This is Nikki. I was able to make it on time. I had a scheduling conflict
Awesome.
today. Yeah, so I'm glad to be here. Good morning. My name is Nikki Ramirez. I'm new to the policy specialist position with DES. However, I've been with DES for about 11 years. I'm happy to be here with you today and in the coming meetings to share the DES policy updates. Jessica had been sharing these with you, but either myself or Adele, we will be meeting to share these with you going forward. Like I said, I'm here today to be able to do that with you. We do have quite a few updates to share, probably due to the holidays. But really quickly, I wanted to touch on the policy change regarding the race and ethnicity data collection that was just mentioned. We would report on this next week since this was something that just recently changed, but so effective, all applications completed on or after the 16th of January. So it's not yet occurred. The USDA's Food and Nutrition Service, or FNS, published a final rule that changes how racial and ethnic data is collected for NA, or nutrition assistance. So NA applications include the option for applicants to indicate their race and ethnicity. Currently, if the applicant chooses not to disclose this information, SNAP state agencies are required to record this information using alternative means, including visual observation when reporting data to when we're reporting that data to FNS. The final rule removes the option to use visual observation as an acceptable alternative when this information is not provided by the applicant. So we'll report on that a little bit more next week. But yeah, I did want to mention that since it had been brought up. But going back to early December, the what's changed highlights would be that any work requirement exemptions for refugees. There was a little bit of a clarification there. The refugee exemption for nutrition assistance work requirements has changed. To be eligible to receive the refugee exemption, the participant is required to meet all of the following. So all or nothing, eligible for the refugee resettlement program, which is like what's been done with our VOLAG offices or VOLAG offices, or the programs that are provided by those offices, and that those would be subject to the work or training programs provided by the RRP private sectors provided or the refugee job services. There were also some cash and procedural updates. Going a little bit fast here. If we can go to the next slide so everybody else can follow along. Thank you. So the week of 12/18, due to the able-bodied adult without dependents implementation, receipt of all months an ABOD participant received nutrition assistance in the current 3-year period must be verified. So basically, when an ABOD participant that received nutrition assistance benefits in another state moves to Arizona, we must also verify when those benefits stopped. So we're looking at all months of participation, regardless if it be within the state of Arizona or other states. And when nutrition assistance participants does not meet an ABOD exemption or the ABOD work requirement, benefit months count towards the 3-month time limit. Participants that do not qualify for an exemption or who are not meeting the work requirements would be then ineligible for nutrition assistance in the current 3-year period. However, I do want to note that all months before July of 2023 are not countable due to the federal suspension of the ABOD time limits as a result of the Families First Coronavirus Response Act. All right, so 12/26. The CNAP manual is going through a reformatting project to complete all of the following. Change the look and feel of the policy by changing the table of contents layout, reducing the number of references to make it easier to find what is needed. And I believe in the slides, we also provide the link to the policy. And so that'd be something that you can go ahead and check out or start to notice these things and how we're changing them. And so for this past week, it looks like there are new methods for cash and nutrition assistance overpayment collection. The Office of Accounts Receivable and Collections, or OARC, is currently accepting nutrition assistance and cash assistance overpayment collections through the TouchPay portal and kiosk. For more information that you could be able to provide those to your clients about the TouchPay portal, would be to visit the website at touchpayonline.com, it looks like. Or there's a phone number regarding like the kiosk locations and where they can actually physically go to make those payments if needed. And that number is there listed for you as well. Also, big news, the 2024 Social Security Administration cost of living adjustment COLA increases have occurred, and the Social Security Administration announced changes to benefit amounts and Medicare premiums based on the annual cost of living adjustment, or COLA, effective as of January of 2024. Beginning the 1st of January, the new maximum amount for supplemental security income, or SSI benefits, for an individual is $943, and it is $1,415, so $1,415 for a couple. Still going. I know I'm moving pretty quick here, but always feel free to reach out to us if you need to via email or the policy support inbox if you have any questions. So there have been some additional cash and procedural updates that have been made, but the Arizona minimum wage increase for 2024 have been updated. And so the minimum wage for the state of Arizona and the city of Flagstaff have increased as of the 1st. And the state of Arizona is increasing the minimum wage from $13.85 per hour to $14.35 per hour. Note that Arizona allows employers to pay a tipped worker $3 per hour less than the Arizona minimum wage. And the city of Flagstaff is increasing their minimum wage as follows, from $16.80 per hour to $17.40 per hour for non-tipped workers, and then from $14.80 per hour to $15.90 per hour for tipped workers. Whew. All right. I think I'm done, Myra. I'm not quite sure. Should I go over this or no?
Thank you, Nikki. That was
You're-
a lot. Thank you so much. We will send, as usual, we will send the PowerPoint and we are recording this meeting, so we will send out the recording as well. All right, so moving right along. All right, so hopefully most of you received the email I sent out about the Justice for All poster. Unfortunately, we don't have the new posters available yet. So we're asking you to please make sure you have a poster. Many of you have the 2019. If you have older versions, there is a link. And Marina, this is something new. There's a link now available where you can print out the poster. Am I correct?
Hi, Myra. So we have not seen any movement with the And Justice for All posters the past 2 years, right? There have been some challenges in obtaining these posters, but I also want to make sure that Arizona is compliant. So if you do have a 19 poster, please continue to use that. My fear is for the community partners that don't have the posters, let's try to see if we can work with those companies to print those out if they can. If not, it's not required because I'm not sure what the cost to do this is. So we can talk about this a little bit further. This is an email my partner and I had drafted, and we sent out to our community partners. I wanted to make sure that everyone is on the same page when it came to the And Justice for All posters. The poster was amended back in May of 22, so their 22 poster is outdated. So, like I said, we're still waiting. I have been in contact with our USDA contact, and we haven't, we still don't have an ETA on those posters. So, you can find a version of the poster. We do utilize the blue, and it's referenced here. It's the AD-475B poster. You can find it there. If you do, what I will ask is this, it's not a requirement, but if you do print this out, please notify us so that we can keep track of who had to, print these for display. That is my only ask. Thank you so much. And just, be in contact with us. If you don't have one and do not plan to print it, or if you do plan, either way, just communicate that to Myra and myself. Thank you.
Thank you, Marina. As I've been going out to site visits, I have been seeing the poster up. So as recent as yesterday. So thank you all for having that poster up. It's really critical that poster is posted. All right. Again, this is a standard slide that we always have that has the CNAP manual that Nikki referred to that's being updated, and the FAA policy support team and other resources here. And that's it. And we also want to recognize Martin Luther King Day, January 15th. So some people take the day off and some people take the day on and volunteer. And, just wanted to take a moment to recognize the significance of the day and his contribution to the civil rights movement, to the world in general. Anything else? Any success stories? Oh, here we go. Yeah, part 2 at 10:30. We'll show the video. If anyone wants to share any success stories, any challenges, Munira, if you're on, I know we talked about a couple questions you wanted to bring to the table today. But feel free to unmute yourself and ask questions, share comments, etc.
Hi, this is Anna from Tucson. I have a question about the surveys.
Yes.
Hi, Maida.
Hi.
So I jumped on a little bit late, but I went on to the actual PowerPoint that we're looking at that you sent via email,
Yes.
and the links don't work. Was that just kind of to show this is what you kind of do and then go to the USDA and look for the surveys? Or are you guys going to be sending them separately? Because when I click on the link on the PowerPoint that you sent earlier, it's not working for me.
Okay. Are you referring to the consumer surveys or the civil
Yes.
rights training? Okay.
Consumer surveys.
Could try this. This is the PowerPoint that I'm working off of right now, and it did bring it up. I don't know if you can. There it is, right there.
Okay, it did. All right, well, maybe because I was on, who knows, maybe because I'm on this meeting with another PowerPoint, and then I tried to open up another PowerPoint and the link didn't work. So let me try later and then I'll reach out.
Great. Thank you,
Okay.
Anna.
Thank you.
Yeah.
I have
Please.
a question. This is Manira.
Hi,
Hello.
Manira.
Hi,
Hi.
guys. Hi, everyone. So my question is regarding the SNAP training. Will there be some kind of a training that you guys are going to offer? I know, like in the past, you guys have there was a training that I had attended at St. Mary's one year, some years back, but I want to know, do you guys still do that?
Manira, you're referring to a training on how to complete the SNAP application, correct?
Oh, yes, that's correct. Sorry, let me clarify that.
No, that's okay. Marita, can you help respond to that question? I actually don't know the answer.
Yeah, absolutely. So let me circle back with Dabimi. I'm actually working to get a training scheduled. Let me try to work with Dabimi and the access team to see if we can get training for both. Let me work on that action item, and I'll get back to Myra, and she can get back to the entire group next week.
Okay, great. Thanks for that. And then my
Absolutely.
other question for you was regarding when we are finished filling out the SNAP application, and then the applicant calls the number for SNAP. The automated message actually tells them that they can go into one of their local offices and do the interview. And we have been sending them down to the SNAP office to do the interviews, but then we found out that that is not the case, but it's still on the recording when you call DES. Is there any way we can get that changed?
Thank you for bringing that to our attention. Nikki and Adele, can you help with this question?
Sorry about that. Forgot to take myself off of mute. We can look into it for sure as far as why it is that they're not able to complete those interviews at the office. I don't know if it is just maybe a location situation particularly. Can I actually get that from you? What office it might be? If you want to stick it down there in the chat, then I can check into it, and I can let you know a little bit more.
Okay, sure. It was actually the Chandler office, but what we were told was that it was across the board, that what they don't actually do the interviews there, that they would have to leave their phone number, and they would put in an appointment request, and then that somebody would actually reach out and call the applicant back. So it's not that they can actually just go in and do an interview there.
Okay. Like I said, I will go ahead and get back in touch with Maida and let her know what it is that I'm able to find out, if that's going to be like a general practice going forward. Unfortunately, being removed from the local offices. I don't get a lot of like what's going on the day-to-day basis. But yes, for sure, I will get that checked out.
Okay, great. Thanks a lot, guys.
Thank you both. Munira, one other thing we talked about yesterday, accessing the applications, copies of the SNAP applications.
Oh,
Um,
yes. Yes. So I would like to know, is there a way that we can order bulk applications, the paper applications? Because I know we actually had to go down to the DES office and see if they would, give us a stack of them, because we do use those pretty regularly, just because the population of applicants that we service are mostly refugees, and a lot of them feel more comfortable being assisted on paper or doing it themselves. The point is that we need, so printing them out, that is just a lot. One application is just a ton of pages. So we resorted to just picking up a stack. But in the future, can you guys, are you able to order bulk or something, and then maybe we can put that in our orders when we order marketing materials and stuff from Wildfire? Maybe this would be something that we can order. Is that possible?
This is Gloria. I just put on the chat, Myra, is this something that can be added to the resources list? And we can certainly work that out on our end, where we can get applications ordered and delivered. It's not a problem. I don't foresee a
Yes, absolutely. We can add that to the materials order form, and just integrate it seamlessly into the process of ordering brochures, etc., with Wildfire.
Oh, that is great. Yeah, thanks a lot, guys. This is a lot of help.
Would you please put in the chat how many you need right now? So we can coordinate in getting those paper applications to you within the next month or a couple weeks. And then Marina and I can look into that.
Okay, sure. And is this a monthly order, or would this be how much are we talking about? Are we talking about ordering every month, every 3
Let us
months,
know what your
3
need
months?
is right now for maybe the next quarter. What are your thoughts, Marina?
Sorry, Gloria. I think that's a great idea. I'm trying to find my mute button as well. I was drafting an email about the training. So yeah, I think that's a great idea. If we can start doing those orders on a quarterly basis, that would probably behoove the general partnership. And I think let us know what the need is, and we can definitely help out.
Okay, great. Quarterly basis. Thanks a lot.
You're welcome. Thanks, Gloria.
Thank you, Munira, for bringing that up, because that's something we're seeing some more requests on chat, so that was excellent. Anyone else have any questions, any comments, anything you would like to share before we wrap up? And when I say wrap up, I will stay on so that at 10:30, if anyone is available to watch the civil rights video, I will present it. I did share the link, but there was an issue with that. Marina, is there any way you can send us a link for that video? We tried recording it on our end, Chris and I, and the sound was inaudible. So what do you
Are you
advise?
able to, so when you normally log in to Traycor, are you able to log in and just display your screen? That was my general suggestion, is just play it to the audience the way you did the first time. Unfortunately, I wasn't there for the training, but I'm thinking if you train, you're recording this session anyways. That way, when this goes out as a recap to the entire audience, they'll have this as a recording as well. And they
Okay.
would just be able to fast forward to the section, to that 10-30 minute section, and then they'll be able to take the training. We
Okay.
can do that, or we can just start up another meeting and record it then. however you'd like. I thought that would be the easiest thing for now.
Okay, so we will, after the presentation of the civil rights video, I'll play it again to see if the sound works. Hopefully it does, and then we will send it out, and then that will be available to you to share with your staff, because you have volunteers, etc. So that's really the easiest way to make it accessible to everyone.
I have a quick budget question. I don't know if this is the right place for it. This is Anna again.
Yes.
So I saw that the payment came in, I think yesterday, but what's weird is August came in and October together, but it skipped September. I was just wondering, maybe Chris, we could talk, I was wondering why it skipped September. The check came with August's payment and October's, no September.
I believe, wasn't September sent earlier? Is that, we're sort of out of order.
That could totally be the case. Let me look at that. I actually just saw that email come through and I thought I'd ask. Okay, very good. Thank you.
Yeah, no problem.
Yes, if you have any questions in terms of the checks, Kathy, our CFO, shared with us a list by partner and the amounts of the check, and great news. Thank you, DES. We received a check in the mail yesterday, another reimbursement check, and Kathy will be working on cutting checks Thursday.
For November, right?
For November, correct. So there will be another mailing going out probably on Monday or Tuesday, the latest. And then December is due, your reports are due January 10th.
That's today. We didn't actually have a slide for that. I'm sorry. But yeah, today is our deadline. So make sure you're getting in your monthly reports for the December activity and invoice. That's due today. We're going to be sending that off to DES pretty quickly, so make sure that gets into the deadline by today. Sorry.
Hi there.
Go ahead.
Hi there, this is Ariana from Aster Aging. I just had a quick question. I just wanted to double check and make sure that I had the dates correct and that the consumer surveys are from January 22nd through the 31st.
I believe the way it was done last year, and then the policy manual, it says the last 2 weeks in January.
Okay, awesome. And then I just wanted to double check, and those are going to be due on the February 12th, or is that the 9th?
I think it's the 9th, but those are not hard deadlines. For the fiscal reports and program reports, we definitely want to nudge everyone to get them in on time so that it's cleaner. We're not submitting supplementals to DES and it just gets a little complicated. So for the surveys, we want you to do your best. So if you're having challenges, or you're having events coming up after the date, just let me know. That what we really want to do is gather content. Content is more important than a specific deadline. So if you have an event after the 2 weeks in January, the last 2 weeks, you have an event for Valentine's Day and you're going to have a significant amount of participants there and you think that's the day to gather the info, just let me know.
Okay, thank you so much.
Thank you, Ariana.
All right, so if you're entering paper, if you're distributing paper surveys, then you want to get those results in, that, like Myra said, it's not a hard deadline of February 9th, but if you're allowing clients to just fill it out on their own online, then it gets immediately sent to Wildfire, so you don't need to worry about that, but it's just the paper ones that sort of have that deadline on the 9th. But yeah, if you could ask all of your clients to complete a survey during this period of January 22nd to the 31st.
Awesome. Thank you so much for clarifying.
You're
Yeah.
welcome. All right, so we're going to wrap up part 1 and get your popcorn out. We're going to do the video presentation part 2 in a few minutes. Chris, anything else?
Yeah, as we do that, before we start that, I just wanted to kind of go back to this and say, like, after we're done with the civil rights training, you can come to this PowerPoint. Oops, sorry. And talk about that. can click on this link to update the records for all of your staff and volunteers, and you'll get this. Oh, where is it? There it is. You'll get this. And we have had some additional questions come in, so I'll just make sure that this is working with you guys real quick before we start this video. But when you go in to look at your civil rights training here, so even if you've entered people's names and information here, you should be able to just go here and say like, okay, this person has received the training. If you just click there, you can say yes, and then you've got a date of training here that you'll need to update, and it'll be today. And then that should be all you need to do. You won't have a submit button until you click yes, these records are complete and accurate. So maybe some of you are coming up against that. When you click yes, then you'll have the opportunity to update this and it will get recorded. If there's new people that are being added, it's the same sort of process. But again, you can go back and you can change any of this information. If somebody wants to get an email now, you can change that to yes and put in their email. If you no longer want them to get an email, you can click here and say no, and then we won't send them emails anymore. If they've been trained, or if you were wrong on the training, you can say no, and it's going to disappear. If anybody needs to get updated for today, you can just click yes. But again, you have to click this button here in order for you to update this form, or else it's not going to let you save anything. You have to say yes, these are accurate, and then update it. This is just sort of a check, but it's also kind of necessary for this form to work. I had to add this. So once you update it, it's going to say, well, anything missing here, make sure that you clean it up, and you can actually get rid of rows if it's blank with that button there. Make sure that there's a date for training when it's necessary, update the form, and that's what it takes. So you can do that for all of your people that are going to take the training or that have taken the training recently. Make sure that's up to date after we're done today.
All right, if there are no more questions, then we'll take a little break, and anyone who wants to join us share the invite for this meeting, and we will, I think Marina chatted that someone asked for the authentication code. You can send me an email and I'll share the authentication code with you. Marina, will you share your screen and prompt the video, start the movie?
Yeah, absolutely. I'm trying to get that back up right now, so bear
Thank
with me.
you.
I'm having some tech issues. All of a sudden, it's telling me that I can't launch the content. Give me one quick second, okay?
Absolutely, take your time. And again, we will, this will not be the only time you can see the video. We will make sure that we figure out how to get you the video, a link recording, so that you can share this with your team. There we go. Thank you, Marina.
No problem. Here it goes. I just want to make sure that you can hear the audio.
Okay.
So I'm taking evidence of it by the end of the year. So
Hey, Chris, can you mute everyone, or tell me how I can mute everyone?
I was a trial lawyer. The rules of evidence. This job doesn't.
I apologize, everyone. I cannot
Well, it does at times where they say, hey, I need to put this in.
communicate with these folks
court.
who
One
are
was,
not on mute.
Myra, can you hear me?
Yes, I can.
Click on the participant button at the bottom of Zoom.
Records that I paid it. So when I went to court,
You should get a list of participants, and you'll see whoever's talking at the top of the list. You can mute
notification
them.
that these are evidence filed with the court, they're introduced to court trial.
Got it.
There should be a button also to just mute everybody and then have them, they can unmute themselves when they're ready to.
Awesome. Chris, you're the best.
There you go. That worked.
Yay! Yay! Happy New Year.
Also, I don't know if you got my message, but I made a couple of proofreading changes to the PowerPoint that probably aren't in the one that you're showing us right now. Not a huge deal, but if you want to just reopen it, you should have them.
I saved it on my laptop, so do you want to share yours instead if I stop sharing?
Oh, okay.
Yeah, because once I finalized it, I saved it on the desktop.
Okay, I'll share it.
Okay, so I have to stop sharing, right?
I think so.
Good morning, everyone. We're setting up. We'll start in a few minutes. Thank you for joining.
How's that?
Perfect.
Okay.
All right. All right, let's get started. It's about 9:30 now. So good morning, everyone, and Happy New Year. Looking forward to working with everyone. And my partner, Chris, is on the line as well. Hello. Chris, you want to move on to the next slide?